Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Well, no one expects to be the victim of an accident, but they can and do happen, and the level of care you get in the moments after a car crash or a fall could make a huge difference in the length and the success of your recovery. And here to talk about this is Dr. John Heislip. He's with Surgical Associates of Richmond and Johnston-Willis Hospital. And doctor, we should point out that Johnston-Willis just became a level 3 trauma center. And explain to our viewers what that means. What's the difference in care now that you've reached level 3 status?
So level 3 status allows us to take care of patients in an organized and efficient manner. We are coordinating with other state hospitals that are trauma centers. We can take care of mild to moderate injuries, stabilize patients. We can operate on them emergently if needed, and we can transfer them if needed.
And what is the difference in terms of their overall recovery when they are taken to a trauma center that can deal specifically with the problem that they're dealing with at that time?
I think it's been shown that patients that are taken to trauma centers have a lower morbidity and mortality rate overall, are cared for in a more efficient manner. And certainly we do work together to get statistics that will help future trauma care throughout the country, and it's been shown to be a big benefit, and we're doing it to help our community. I think it's a good idea.
And so not only is it going to help the individual patients that come and see you, but it's also going to save money, help the hospital system, and help the community overall, right?
It can save money. Certainly if patients are cared for and they're not in the hospital as long, if the injuries are will have less severe effects on the patient, that will benefit from a cost standpoint. Certainly from a standpoint of improved survival and less injury to the patient long term, it's a benefit.
And is there something a patient, I don't know, in a moment of where you're the victim of a trauma, how do you know what hospital you're going to be sent to? Is that something you have control over?
Actually, you do have control if you have an injury that you go on your own, but probably 40% of patients that are in trauma are taken by emergency medical services, and they have triage criteria. They know where to take you. And they generally will take you to a trauma center for most injuries, and they know what level you need to go to.
Okay, all right. Dr. Heislip, thank you for this information. We appreciate you being here.
Thank you.